Hello, this video will discuss how CII-CPAR e-notifications can be managed in the PS Suite EMR. E-notifications are automated messages delivered directly into a physician's EMR with information about key healthcare events for paneled patients, such as emergency room visits and hospital admissions or discharges. E-notifications are received in the EMR daily at 6 a.m. and 2 p.m., similarly to an electronic lab report. Note that e-notifications about a patient are only sent to the provider who is identified as that patient's primary provider in CPAR. If a patient is paneled to more than one provider in CPAR, an e-notification will be sent to each of those providers. For providers working at different locations, e-notifications are sent to the location where each patient's panel is maintained and submitted to CPAR. When in the EMR, each e-notification message contains the following information: the patient's PHN, patient name, and alternate identifiers, for example, if they have an out-of-province PHN, and this is to ensure that the correct patient is found in the receiving physician's EMR system. The e-notification also contains the type of event, so this could be an emergency room visit, inpatient admission or discharge, or day surgery discharge. The date and time of the event are also included, as is the name of the facility where the patient was seen, the attending physician's name, the referring physician's name if available, the reason for admission if available, and any other providers that the e-notification was sent to. For instance, the patient in this example is paneled to more than one primary provider in CPAR. Notice down here that one other provider has been notified. Also note that the date of the event here will not necessarily be the same as the date that the lab was received in the EMR. The event date is in the body of the e-notification, while the date that the e-notification was received in the EMR is in the lab details at the top of the lab posting preview window. To access your e-notifications in the PS Suite EMR, you'll go to Records, and then in the new window that appears, go to File and then Lab Report Inbox. In the new Lab Report Inbox window that appears, you can open all of the reports by clicking Enter. To view a particular e-notification report in the list, you can select it from the list and click View down here. When in a particular e-notifications report, you will need to preview the PS categories list and assign the e-notification report a main category and subcategory. The main categories can be picked from this drop-down menu up here, and then the corresponding subcategory can be picked from down here. You will also want to ensure that the main and subcategories chosen for e-notification reports are standardized throughout the clinic. For example, consider standardizing category assignments by always using medical report as the main category and emergency room report for e-notifications about emergency room visits. Also note that you can create your own subcategories by going to Settings, and then Preferences. In the Preferences window, click on Report Categorizing here, then go to the Category Management tab here. Once in that tab, select the main category from the top menu here. Once the main category has been selected from the drop-down menu, click on any of the subcategories listed here, and then click Add at the bottom. In the new window that appears, enter the name of the new subcategory. In this example, we are adding the subcategory Day Surgery Notification. Once you have entered the new subcategory, click OK, and then save changes down here. Please refer to the PS Suite EMR CIIC part guide that is linked to in the notes below, and the PS Suite EMR online help files if you require additional assistance with these steps. Now, once you have assigned the e-notification a main category and subcategory, you will want to press Enter to post the report. The lab report will then appear and remain in the patient's chart as shown on this slide. Also note that since e-notifications are received in the lab report section of the EMR, non-provider staff can also view them. Your clinic may therefore decide to have non-provider staff review the incoming e-notifications, categorize them, and triage them as appropriate. Thank you for watching this video. Hopefully you now have the information you need to get started with e-notifications. You can also find additional information on managing e-notifications by referring to the e-notifications information sheet shown here and linked to in the notes below. For example, if a provider decides that they would like to follow up with a patient about an incoming e-notification, they should first check Netcare for additional information. For instance, Netcare may inform the provider that the patient has passed away or successfully delivered their baby. This is valuable information to have before contacting a patient. It is also important not to assume a positive outcome when following up with a patient.